Yeah, 7 to 12 to 15 minutes per breast, depending on the size of the woman's breast.
And then it takes how long for the?
For the processing, the computer programming, somewhere between 30 to 40, again, it's breast size dependent, how much data points were collected, so somewhere between 20 and 45 minutes to process it.
And so is the patient waiting there?
No, because I'm not the radiologist, I don't interpret the films anyway, they're gone. And then when we get the results, we either send them an email with the link to the normal report, or we call them and there was a question and what the recommendations are.
So when you go from a mammography session or mammogram, and they, they've got somebody taking the pictures and it's not a good picture, so then they make you go through all of that again. Have you had any situations where the,
we've only had that happen twice in 11 months. One of them, and this was a learning experience on our part, the woman was uncomfortable because you're laying on your tummy and there's a little ridge of where the hard plastic of the machine and then your breast is, and she was very sensitive, so she kept moving during the scan and it wasn't a good film. So when we called her back, it was like, okay, I can't make it less. I don't say pain-free because there is sometimes a little bit of discomfort. You have to be able to raise your arm above your head and turn your head to the side, and so people who have mobility issues either with their shoulder or their neck will sometimes go, oh man, I'm a little uncomfortable laying here in this position for 11 minutes. But it's compression-free, right? So it's not the same kind of pain.
What do you do in those situations then, if it's $725 to go through the test and somebody has to come back, how does that affect?
Well, in the two cases that have happened so far, we did not charge the person for a repeat scan.
Okay.
Yeah.
Approximately how many patients have you scanned in the lab, like since you've opened?
I've been doing 50 a month. Roughly. There was a time when we were actually having to limit the number of appointments we could take because we just didn't have the radiologist. So now that, and I'm still reticent to kick up the volume to full power because if I only have one radiologist that's reading for 3 centers, I don't want to overwhelm her and then have her tell me it's over a month to get a report. I can't do that. But I believe more radiologists will be on board soon. I'm working very hard. I have a different, similar kind of presentation that I do for radiologists to give them more scientific information on this and try to get them interested in the whole thing.
Is there any variability to the results based on, say, the tech doing it or the scan on Monday?
No, it's not that we've seen.
Okay, cool.
We do tests every day on the water quality. We have specialized equipment to analyze the purity. It has to be really deionized, degassed, less than 10 parts per million. Of any solids in the water. That's how sensitive the equipment is. We do a phantom scan every day to make sure that it's working and it looks good before we start.
And when you go for a regular mammogram, no deodorant, no powder, no lotion,
Right.
Is there?
Well, we do say no lotion on your breast because it would just seep out into the water and make particle counts go up.
Right.
But yeah, shower the morning of, just don't put lotion on. Deodorant's fine. It's asking good questions. All right, well, thank you for your time. I wish these are not easy decisions to make, so keep your ears out, spread the news, spread the word. I have some cards here that have the information to just the QT part of our practice. You guys are getting excellent care here. So we actually have referral. One of the we have questionnaires that people take. You don't need a referral from a doctor to come to us, but we do like to know, you know, if you are referred by someone so that we know who our collaborative partners are. But you know, yeah, these have like QR codes that take you right to the web page that has more information on the QT imaging, and then there's a request to book a scan. Dr. Naomi, if you want one of these, we have one that is good for a desktop too, so, yeah.
Yeah.
You just keep that at your counter.
Thank you.
And then I have a few handouts here that are just trifolds that go over some of the information that I've already gone over, this evening for you.
So you and one in Iowa is the only in Midwest,
There's one in Peoria.
huh?
There's Peoria,
Peoria.
3 hours south, yeah, 3 in the west.
Okay.
But this one's first and best.
Yeah, we were the first. We, you know, it's not for the faint-hearted to be a trailblazer, you know, it's just. And I say that to the women coming for the scan too. If you get the scan, you're a trailblazer, and it's not easy because, you know, people, God bless them, they want their regular doctor to approve of the scan. They're like, well, will you talk to my doctor about how good it is? I'm like, no, I can't. I can't. I can give you data, I can give you websites, I can give you access to studies, but I cannot force somebody to open their mind to other things. But hopefully, if someone says, I have chosen this, their doctor will honor their flippin' autonomy rather than say, you're a bad patient, you didn't get a mammogram. But there are some doctors who are that way, right? You don't do it my way, I won't be your doctor anymore. That's sad.
Do you find you have some doctors starting to reach out, just wanting to be like referring your services or? does that
Mostly
not happen?
integrative, yeah,
Okay.
other than the breast cancer surgeon that I mentioned. But we've been, so, what, it's the slow growth of this, and then of course running a full functional medicine practice. If this was the only thing I had to do, I would be on the news more, I would be doing more
Yeah.
presentations to people, visiting radiologists, hopefully over time that will come.
Got a lot of advantages. You know, time is on your side.
Thank you guys.
Yeah.
Great. I took so many notes. I feel great about this.